Welcome guys again to Book the Vida, one more episode. Right next to me, I have the pleasure because he opened the doors for me in order for me to do this video with him. His name is Dr. Rivera. Dr. Rivera, thank you for the opportunity to come to your channel. Not to your office, because you came to my channel, so I went to I'm in your office. So anyway, thank you. I got a couple questions for you. A lot of questions, not a couple questions.
Yeah.
But you look like you're serious.
I am, but first, Eric, I wanna say thank you because you show up here to our house, and we're very glad that we have you here.
Thank you.
Right.
No, the pleasure is mine.
Yeah, I know, but I wish you had brought dinner.
Oh,
but
dinner.
It's okay. I will not feel bad.
Okay.
But
all right. All right, no problem. Next time we gotta bring them dinner. Remember that, Jonathan. We gotta bring them dinner. A lot of food, but I think it's vegan. But anyway, a little bit about Dr. Rivera. Dr. Rivera, he's of course he's from Ponce, Puerto Rico. He's been in how long you been here in Orlando?
I mean, 3 years in Orlando.
3 years in Orlando. All right. What's your specialty? What do you specialize on?
Well, I have different fields of expertise. The first one is pain management.
Mm-hmm.
I trained pain management here at the University of Florida a few years ago. I'm been practicing pain management for the last 15 years. But on the road, on the way, treating people with pain, I found that there were common symptoms in all of them. And those symptoms that were common in them, they're also common in other people that don't have pain. So I started identifying these disorders. I came to the understanding that probably humans suffer from a few diseases that have millions of manifestations. But in the essence, many of the diseases are the same. When I try to relieve pain during the using the traditional methods that are covered by insurances, that are promoted by our medical associations, I had way too many failures.
So what do you think? What do you think? What do you think? I mean, what's the best remedy or what's the best method or system to treat pain? Besides,
I think that what we have now is excellent for the acute phases, but we're lacking into how to manage chronic pain. So what I have found with these other treatment alternatives is that you can correct the hormonal imbalances that people that suffer pain will have. You can also try to heal or promote healing, not in the one area, in the whole body. And promoting healing in the whole body by the use of different probably proteins that are compounded in pharmacy, or sequences of proteins that are compounded in different routes to help people promote, to promote that healing. Some people think it's the fountain of youth. I don't think it's the fountain of youth. I think it just simplified a very complex and expensive process, which was to promote healing in a specific joint. Imagine that for a lot less, people can regenerate every single joint, or at least try to. But it's not that you're going to reverse the whole thing, it's that you're going to give it a hint for that collagen to start, be made again. You cannot reverse what we lost, but you can actually make a few gains that can give you good relief.
Understood. But I mean, when it comes to because I know you're an expert, and that's how we met. When it comes to the medical marijuana and the CBD, when it comes to using the traditional narcotics like the opioids, and using the medical marijuana, do you think that it's best using both of them at the same time, or do you think that one works better than the other? What is your thoughts about the medical marijuana being used versus the opioids?
I have a very controversial position there, and I'm gonna get roasted probably by medical societies, but I think the order is wrong. The complete order is wrong. We are starting with aggressive treatments. It's pharmacotherapy, the first step, but non-steroidal anti-inflammatory drugs carry the risk of acute renal failure, acute myocardial infarction, strokes, increased blood pressure, gastric, stomach ulcers. So that's our first line. Isn't that kind of scary?
Yeah, because that's what you get trained for, right? I mean, that's what they train you for.
Exactly. And now, then, you go from that to even stronger medications then you try the procedures, and if there's no help, you go for surgery. And I'm not saying that surgery is not indicated. Many of the times it is indicated. But if we don't treat things right, it's gonna probably end up being, earlier than later. You understand what I'm saying,
yeah,
right?
yeah.
So I think it is important to understand that we need to start with the natural option with the least side effects, and then work our way up. So start with the supplements, start with marijuana. If there's relief there, you're done. You can have a person that can manage their symptom on their own with the need of getting enrolled and trapped in the insurance procedure and medicine cycle that traps so many, and that is so hard to get them out.
I agree. Yeah, because once the patient goes into opioids and the patient creates dependency on the opioids, it's I've seen them. Myself, it's very hard for you to get them out. And also, at that point, if they want to get out, you're gonna have to substitute one medicine for another medicine. To me, the second medicine, I'm not a doctor. You're the doctor, but correct me if I'm wrong. The second medicine, which is buprenorphine with naloxone, is addicted. Sometimes the patients, they get addicted to that medication as well. But I mean, I know I was talking to you off the cameras, and you were mentioning to me one thing that is stuck to my head, and it was not today. It was a few days ago, maybe months ago, that we were talking about the CBD, and you were saying that CBD it's a great component for the medical marijuana when it comes to treat patients with dementia.
Yes.
Why is that? I mean, what's the whole chemistry behind this CBD? And this is just your opinion. You know what I'm saying? This is if you have scientific evidence that this component from the medical marijuana, because the medical marijuana has like over 300 or 400. The CBD, you're saying is good for the dementia. How is that possible? That CBD.
Okay. So if you give me pure CBD, probably it'll have good effect, just because there are receptors for CBD in the neurons. It is an excellent anti-inflammatory in the nervous system. We know that most of the pathologies in humans involve some sort of inflammation, so that's where it actually helps. But there's another more important step. Most of the CBD preparations that we were having before had a small percentage of THC on them. And you know what? Here in the University of USF did a study years ago that a private company had bought the rights to that study, so I cannot disclose. But I was involved when they launched their medication in another jurisdiction. And this medication uses both CBD and THC, but does THC in very low percentages, because if you use THC in very low dose, you actually cleave the protein that accumulates in the brain, which is the beta amyloid, and causes the Alzheimer. Bad thing is that protein started accumulating there when you were 30, and when you're 60, then the Alzheimer exploded. So by the time you get the first symptom, or someone gets the first symptom, it's already late. So I'm not saying that it is prevention, but that small detail brings hope.
So if you start using CBD at a young age, you can, from what you're telling me, so people can understand, is you can probably prevent from getting Alzheimer's with time.
Well, we have no evidence to say that. The only real prevention that we have found against Alzheimer that is consistent is hormone replacement. Hormone replacement can push the onset of Alzheimer up to 10 years.
That's another thing that he does. Dr. Rivera, he's an expert when it comes to hormone replacement. That's another, I'm not even going to say a specialty. That's another thing that you do in your clinic. Am I right or wrong? You do
You're right.
Hormone replacement, and I think that you have a new baby coming up. You're starting a new project. I think you have something coming up tomorrow, like a soft opening. What is it that you're having tomorrow? What's your new baby? What's if you want to talk about it? What is it that you're going? Because this guy is an achiever. He does everything, but he's trying to do everything. But on this new project that you have, what is it that you're trying to do here?
Well, out of that side of medicine that I was explaining before, when we're trying to correct all the disorders in humans in order to correct pain, there were some side effects from that treatment. People are losing weight. People are getting smarter. The fog in their brains going away. They're getting energetic. They are abandoning antidepressants. Not everybody, some of them, right? So you know what? It's another measure that brings hope. Out of that, I have seen people gain the spark in their lives just by us doing minor adjustments. That, if they were done on everybody when the symptoms are early, would probably be avoiding diseases. Now, out of that, those effects that were collateral to the pursuit of pain relief, ended up a project was born, and it's called Prometheum. Prometheum mixes different type of alternative treatments and experimental treatments that are actually very safe to use, and combines them to enhance the performance of individuals, people that are executives, weekend athletes, all my friends who are retirees and now they want to not only play golf, they want to play tennis. They wanna be on top of their game. They wanna be in the sport car. They wanna live. I see now that as we age in this times, 50 years is the new 30. It's this is the time when the kids leave the house and you find yourself with your wife now with all the time in the world to hang out. But imagine if that catches you weak. Yeah, with that sparks lost, overweight. What if I can tell you that I might not be able to revert all, but I can help you feel better so you can enjoy life, and that's my goal.
I mean, what is it that you're using to make you feel better? I mean, I know you're probably gonna have to do some blood work, see where you're lacking. I mean, I'm not a doctor. You're the doctor. Are you doing some compounding treatments? Are you doing some testosterone? What is it that you're actually going to be doing for a patient that, I mean, you're looking at the blood work, what will you do for that? You don't have to get it, you don't have to tell me, you don't have to go into details, because maybe that's something that you want to keep to yourself. You know what I'm saying? And I understand, I respect that. But, what are the treatments that you, and how that you will take, or you will give to that patient, and how will you get to that treatment? How will you achieve that treatment for that patient to make them feel better?
I wish there was a simple answer, but every human is a universe. Imagine that you can have people in a party eat the same thing, the same salad that was infected, and only 2 out of 20 got the disease. How can we explain that? Every human is different. So is the treatment of their diseases. I wish I had a cookie cutter. But there's no cookie cutter. What I do is I examine. Yes, I examine labs. I probably examine more labs than any usual medicine primary care clinic will do, or any other specialist would get, because I really get into details. But it's not only labs. I also get a very detailed history, and I go through every symptom possible there is for someone that comes. Actually, what they come looking is to lose weight or to build muscle mass. But I can identify diseases that are coming up that you don't even know they're there. Because in medicine, we were taught that diseases exist in abnormal labs. But what if I tell you that many of the diseases exist within normal labs and normal parameters? And that's the early stage of the disease. Disease starts now, and when we actually get the first symptoms, it's already late. I want to be the guy to change the history of the person. I want them to prevent those things. I want them to have a plentiful life. I want the 50s to be the new 30s. I want the 40s to be that time when you achieve the most in your life because you feel well. I cannot promise wealth, but I can deliver some relief and increase the energy a bit. I can do that. I cannot, do major changes to rebuild the person. But hey, we're used to play with broken toys. So if you increase my strength 1%, I'll take over the planet. Yeah, it's a figure of speech, but you know what you understand.
No, I understand. Yes. So that's going to be your new project, treating hormones, testosterone on patients.
Well, we're changing one of the treatment factions to live on its own and to separate, because we're actually, what we're doing is expanding now the reach and make it available to people that just want to prevent or want to get stronger, want to get keener, want to get sharp, or just want to feel better and increase their energy. And another thing, increase their sexual desire. I'm going to tell you something, because I think this is important for actually people to know. As we age, there's going to be hormones that's going to start dropping, but they're going to start dropping within the normal levels. So as physicians, we say, man, at testosterone 300, he's 60, it's okay. What if I can bump it up a bit, and his energy comes back, and his desire comes back, and he starts losing that belly that we were told is part of age. I come from a country that after you get married and you go in your late 30s, early 40s, everybody starts growing a belly. And it's all normal. And I say, no, it's not. Testosterone started dropping. So once that starts to drop, the waist goes away. And then we come from being the guitar to being the
bass. No, the bass, yeah, the bass.
Exactly.
Bass, yeah.
And it happens to both men and women. Women, the thing is that they only have 10% or more of the testosterone that a man has, but they need it there to energy, to relieve their postmenopause symptoms, to increase their desire and to lose weight. Yeah. So we are all suffering from the same problem, or well, not all of us, but a big chunk of us are fighting that every day.
Well, I'm going to sign up with this guy because I want to see the results. In 90 days to 120 days, we're going to do another. We're going to do a podcast plus a live. Because we have a new. By that time, we're going to have a new setup. So we're going to be live, right, Jonathan? We're going to be live. That there's not going to be no. We're not going to edit or cut anything. And so I'm gonna enjoy his program. I promise you, and I'm gonna see how much I lose and how much energy I get. But I want to touch another point before I let you go. Stem cells. Is that something that you use or you would like to use? Because there is different stem cells too. There's one that you get from the plasma, right?
Well,
you can correct. And then they have the other one that they get from the umbilical cord.
Well, stem cell treatments has multiple factions. Right now, I like to call it mesenchymal stem cells. And now let me go over a few so people can have an idea. You can get what it's called platelet-rich plasma, or famously known as PRP. That one, the blood is withdrawn from the person. We centrifuge the blood 2 times. We get the platelets and the growth factors. We inject that in joints or tendon. I do it on the ultrasound guidance, which is very simple. I can see the soft structures, and I'm going to use the same ultrasound to inject the other ones. Some of them I need to use an x-ray machine, but that doesn't matter. We have all that available. I have used that mainly for joints and tendons, as I said before. Now the other type of stem cell treatment was the most popular option in the past, which was we were draining the stems, getting the stem cells either from the person's fat, or we were getting them from the iliac crest, actually the bones in the hip, right? And it involved a long process, but it was also it was effective. Then pharmaceutical companies or biological companies started working on the project and started extracting those cells directly from the placenta. All right. Yeah. And they can use the side of the baby, they can use the side of the mother. Another group started using exosome, which is actually not the cell, but the active components of the mesenchymal, that stem cell, multiple potential molecules that you will throw inside a joint that is damaged, and there is some evidence that it helps. It's not FDA approved, but as you know, there is evidence favoring. Then there's another faction that started a few years ago, which is the amniotic fluid. The amniotic fluid, we know it doesn't have stem cells on it, but it does have growth factors that are people that are mixing them. Yes, I saw one company that was offering mix. So
those
are the factions. Now we can keep enumerating them because this is a doctor. I think it's a doctorate degree. Now, when you tell me that physicians are afraid, I can only tell you that I know through my years and history that fear is actually a derivative of ignorance. In the past, we used to burn people that had scientific knowledge because we thought that chemistry was witchcraft. We were fearful of the smart people, and we burned them at the stake. And we kill Gandhi, we kill Kennedy, and we have done awful things to people that are very smart. And now I tell you that stem cells is suffering the attack. But once we get the knowledge and the medical community accept the evidence and start studying it, because I was like that. I was a skeptic. I was a skeptic about marijuana. I was a skeptic about hormone replacement therapy, peptides, until I read the evidence and then saw it functioning in people and giving me the satisfaction of getting people to feel better. That's priceless, Eric.
Dr. Rivera, please support. Mi gente, aquí tenemos al Doctor Rivera. Lo voy a decir en español porque yo dije que esta entrevista la iba a hacer en 2 idiomas. Él habla español perfecto y ahora lo acabo de escuchar hablando brasileño. Por poco me caigo. ¿Qué más idioma tú hablas?
Eso es portugués, bro.
Oh, portugués. Mira para allá. Imagínate que yo soy un jíbaro. Pero mira, portugués. Pero suena casi igualito que el brasileño.
Eso es lo mismo.
Es lo mismo, entonces me dice portugués. Anyway, para personas que quieran verlo, hablamos de la célula madre, hablamos de la marihuana medicinal, del dolor, hablamos de el proyecto nuevo que él tiene. Pero apóyenlo, de verdad. Aquí hay mucha gente que no están él está en Winter Park. También voy a poner la dirección de él. Lo pueden llamar. Este médico no duerme. Este es 24/7. Algún día va a dormir. Pero anyway, muchas gracias. Thank you, Dr. Rivera, for having me in your office. Gracias un millón. Book de Vida, subscribe. God bless everyone. Thank you.
Thank you. I love you, bro.